Welcome to Rumor Has It, the podcast that busts myths, highlights evidence, and inspires hope for living better with rheumatic disease.
Through plain language interviews with experts, we offer actionable knowledge so you can thrive today.
My name is Eileen.
And my name is Cheryl.
Join us as we bust myths
and spotlight evidence.
And today we have a very special guest from Canada, actually one of the researchers with Arthritis Research Canada that I've had the pleasure of collaborating with and also hearing speak before. We have Deborah Costa here, and she lives in Montreal. I'm going to let her describe the work she does and her background. But today we're talking about a very appropriate topic because I didn't get very much of it last night. We're talking about sleep. So Deborah, can you let us know a little bit about your background and how you came to specialize in sleep?
Sure. So I'm a health psychologist, and I've received training in administering behavioral approaches to treat insomnia. And early on in my career, I conducted a couple of studies looking at fatigue in people living with arthritis. And one of the things that kept reemerging as an important factor associated to fatigue was poor sleep. And that really sparked my interest in trying to better understand what some of the causes are of poor sleep in people living with arthritis so that we can better manage it.
Yes, I would agree. I think sleep is a very under-discussed topic, especially in the rheumatologist's office, and has such an impact on us. I'm going to hand it over to Cheryl now to ask the first question.
Yeah, similar to what Eileen said, when it comes to lifestyle habits that might improve quality of life, I notice a lot of patients, including myself, initially tend to focus on like nutrition and exercise and maybe neglect sleep. It's almost like a blind spot we have. So can you explain to the listeners a little bit why sleep is so critical for our health and how it can impact inflammatory arthritis symptoms?
Absolutely. So it's interesting you say that a lot of patients tend to focus more on nutrition and exercise, but healthcare providers as well. And those are really important things to look at and to address. But sleep is oftentimes very much so neglected. And it's surprising given that up to 70% of patients who have arthritis experience sleep difficulties. And just for the audience, when we're talking about sleep difficulties, I'm talking about difficulty falling asleep, difficulty staying asleep, early morning awakenings, and just feeling unrefreshed in the morning. Sleep difficulties tend to be underrecognized, undertreated, and or treated only with medication, which really doesn't address the underlying issues. But sleep is essential. It's essential to sustain our well-being, our mental well-being, our physical well-being. I mean, it's a biological process. It helps to maintain metabolic balance. It helps with tissue repair and our overall sense of well-being. The thing about sleep in the context of arthritis is that we tend to underestimate just how important it is. A poor night's sleep doesn't only affect our ability to concentrate. Of course, it makes us more irritable as well. But in the context of living with arthritis, it could also worsen certain symptoms, even when the condition is well managed. And there's a good body of evidence showing that prolonged poor sleep can have a negative impact in terms of pain, in terms of depression and anxiety, as well as worsening fatigue. So all these reasons highlight the importance of better addressing sleep in the context of arthritis.
That's so helpful. Thank you. And I've definitely noticed that in my own life. It can be a bit of like a vicious cycle because then I don't sleep well enough. Maybe I have a little bit more pain and then I'm stressed and then that stress and anxiety feeds. So yeah, the vicious cycle.
Absolutely.
So yeah, I'll hand it over to Eileen for the next question that addresses that.
Yeah, and I would love to just mention because it's not just joint pain. I love saying that. It was our little ACR presentation, that panel discussion that Cheryl and I did. But there's also other factors that when you get a poor sleep with a rheumatic disease, I find the brain fog is so difficult to navigate, and how it also increases malaise. Living with rheumatoid arthritis, I always feel like I have the flu. And when I don't get a good night's sleep, that symptom is so heightened.
Yeah.
And then, of course, there's the GI issues that come with it can really interrupt our sleep. So, yeah, it is that vicious cycle that if we don't get good sleep, we're going to feel worse. And then if we get a heightened symptoms that don't let us sleep, we're going to feel even worse the next day. So it is definitely a vicious cycle. So I know in my own personal experiences trying to navigate fragmented sleep and the disruptions in my sleep and how it impacts me in the day. I think one of the most important questions that we can ask you today is what are some of your best non-pharmacological treatments to manage sleep when you have arthritis, particularly with insomnia and like pain insomnia?
Well, we don't have a lot of published research on non-pharmacological treatments for sleep, specifically conducted with patients with arthritis. But sleep experts definitely consider cognitive behavioral therapy for insomnia, also called CBTI, as being the first line non-medical or non-pharmacological treatment for insomnia. So CBTI is a multi-component type of intervention that really focuses on identifying and changing negative thoughts and behaviors that interfere with sleep. So, for instance, we conducted a study with over 200 arthritis patients to do a sleep needs assessment. And many of them who were experiencing sleep difficulties had this belief that sleep difficulties is just part of living with arthritis. I have to accept it. There's really not much I can do about it. That, of course, is going to perpetuate sleep difficulties. So CBTI focuses on identifying and modifying these types of thoughts, as well as implementing some behavioral techniques that can assist with promoting sleep. So, for instance, identifying, making a stronger connection between the bed and sleep. And how do we do that? Well, we restrict the time in bed that's related to non-sleep activities. So you shouldn't be, for instance, lying in your bed and on your iPad or on your computer. That's not going to make that association between sleep and the bed strong. If you're going to do those activities, try to do it in another place that's equally as comfortable, but just not your bedroom. That's one example. Other things is promoting a relaxing bedtime routine, maybe 20, 30 minutes before going to bed. So this isn't the time that you're going to get into a heated conversation with your partner, for instance. It's a time where, you should adopt some activities like a warm bath, reading something that you enjoy, listening to some soft music, just something to kind of promote it's time to shut the brain off and just, relax a little bit. These are the types of things that cognitive behavioral therapy for insomnia focuses on. And really, in the general population with insomnia and in certain chronic conditions where it has been evaluated more, we see that it not only improves sleep, but it improves other symptoms such as pain, such as depression, such as fatigue. That is really that caught my interest because I know that these are symptoms that patients who are living with arthritis struggle with. So if we can address sleep and address these other symptoms as well, that would be a win-win situation. The thing is, CBTI is not easily accessible because there aren't a lot of providers out there who have been trained. So there's a long waiting list, as well as it can be costly if one goes privately. But there have been internet-delivered CBTI programs that have been shown to be just as effective. They've been evaluated in people suffering from insomnia, as well as those in specific chronic conditions such as cancer. So what we've done is we've kind of tailored one of the CBTI interventions that was evaluated in cancer with Dr. Jose Savard from the University of Laval, and we've adapted it, and we're just completing a pilot study with arthritis patients to see whether or not it's effective and to see, whether it's something that is acceptable to patients living with arthritis in terms of how it's delivered through the internet. And we're excited to see how that turns out.
That's so exciting. And, I think when it comes to sleep hygiene, just to add my personal story, I being diagnosed in my early 20s, I found that one of the most difficult things was actually the social pressure to stay up late. And I ended up adopting a persona that I started calling a sleep diva. And it was kind of I'm I'm a unique individual, so I don't know how this would work for everyone else. But I ended up like my friends on the soccer team would call me like mom as a nickname because I was like, guys, we have to get our sleep before the
Yeah.
big game. And but really learning like to, I think for a lot of younger people, especially learning to advocate for yourself and say to your friends, you wouldn't tell me to just push through not eating all day. Why should I push through not sleeping enough? Is that something you found in some of the patients you've kind of studied? Is that it's hard to advocate for your need to sleep socially?
Absolutely. It's very hard because of this. There is this social pressure that, we don't need much sleep. People kind of brag about it sometimes, where it's like, sleep is essential. It really is. And I'm a sleep diva too, so I get it.
Yeah, I actually looked into I made a t-shirt and then I need to so maybe by the time this is published, I can link I made an Etsy store, but then I never finished. I was nervous about publishing it. Anyway, anxiety. I had a little
Yeah.
anxiety because I was like, "Oh, what if I do it wrong and like don't report the taxes right or something?" Hopefully this will give me a deadline to get the Sleep Diva shirts because I do think that having others around you who support you, in my case, my husband, we joke, but especially when my son was little, that like giving me sleep was like a love language. He would
Absolutely.
take my son for a while so that I could get uninterrupted sleep. And he just knows he's an engineer and that kind of helps because and there's times we sleep in separate bedrooms sometimes when I really need to get a good sleep. And we don't see that in the context of our relationship as threatening our relationship because again, I think it helps. He's an engineer. So we're both like kind of like, you know, this is a body function that I need to maximize. And he knows Cheryl's going to be feeling better. That means I'm going to be feeling better if her mood's better and her everything's, so I am very lucky, I'm going to say. And yeah, Eileen, I think you had some perspectives on that as well.
Yeah, I just have to add in a little perspective as a single woman who finds that to be a very particular troubling situation when you have chronic fatigue and like to go to bed at like 8:30 o'clock at night and you're trying to date. It's probably not considered very sexy. I like to say I'm a grandma and I need to go to bed at, after my 5 p.m. dinner, that kind of thing. But yeah, it is touching on the social aspect of it. The need for sleep and the need for rest can have such an impact on so many aspects of a social life. I'm actually a caregiver to my dad going through cancer right now, and I'm finding I actually have worse fatigue than him. It's giving me a whole new perspective of how bad fatigue is when you live with a rheumatic disease. And back on to Cheryl.
Hmm.
Yeah, absolutely. Sorry. And I want to throw it back to Deborah to Costa because we want to utilize your expertise as well. You alluded to some research that you're about to publish, it sounds like, on CBTI for which is again cognitive behavior therapy for insomnia for people with arthritis. Is there any other exciting or groundbreaking research projects that you want to kind of highlight that are underway for you?
Oh, absolutely. So, another area of research for the last couple of decades is mental health during the transition to parenthood. So, for both moms and birthing persons, as well as dads and non birthing co parents. So, I've done a lot of work to try to understand the transition to parenthood and really to promote mental health during this life stage, which can be very challenging. And although living with a chronic condition is a risk factor for depression during the perinatal period, there really is very few studies that have looked at the transition to parenthood in people living with arthritis and what it's like to be new parents and what some of the challenges are. So that's one of the studies that we've recently launched for patients with autoimmune arthritis with young children to really identify what their mental health needs are so that we can develop better supports and resources that are tailored for young parents living with arthritis.
I want to say that's really incredible because one thing I've noticed as being a parent myself and living with rheumatic disease, my son is 12 now, so I think some of the unique challenges of having a young child is past. But I also found in research there was so much about can we have a baby? Is it okay to take our medications? But little of what about when the child is here? Because that's going to last a lot longer than the pregnancy. And so I really thank you for taking on that role of touching base on that research topic because it's one that I haven't really seen around.
Yeah.
Now, you have provided us with some valuable information and some insights into current research that's going on with you. And we are at the end of our terribly short conversations here. There's so much that we could talk on, but I'm wondering, what is the most important takeaway you'd like for someone to gain from this episode?
Sleep matters. If you're
Absolutely.
experiencing sleep difficulties, talk to your healthcare provider. There are non-medical approaches to help improve your sleep.
Absolutely.
Incredible. And I'm just going to throw in one more fact. I hope this is okay to say. But something that blew my mind was that people with rheumatoid arthritis specifically are at a hugely greater risk of all sleep disorders that even if they have no other risk factors. So like for me, I thought, well, there's no way I could ever have sleep apnea because I don't snore and I don't have any of the other kind of risk factors associated with sleep apnea, but it turns out you can still have sleep apnea if you don't do those things. So I'll put a citation link to that, but I always encourage people when I do my support groups to if like you said, get help from your providers if you're having difficulty with sleep. So thank you so much again, Dr. DaCosta. It's been amazing talking to you. If people want to connect with you further or learn more, where do you recommend that they go?
They can email me.
Oh, great.
Absolutely. So it's deborah.dacosta@mcgill.ca.
Great. And we are also going to put links to your profiles at Arthritis Research Canada and at your university as well. So people can
Perfect.
dig into your research if they want to learn more.
Great. Thank you.
Incredible. Thank you so much for joining us today. It's been an absolute pleasure, and I know our paths will cross again soon.
Thank
Yay.
you.
Thank you. And everyone, reminder to go to the show notes to see all the links to things that Dr. DaCosta and Eileen and I discussed today. Thanks so much. Bye bye for now.
Okay.